is our doctor in residence, Dr. Kevin Kavanagh, who is a retired physician, also the founder of an organization called Health Watch USA. Dr. K. Good morning, Dr. K.
Good morning, Jack.
How are you?
I'm doing really good, really good.
Good. Flight attendants and pilots got to wear diapers in China.
That's correct. I mean, you just can't write some of this stuff. That's from the China Civil Air Administration, similar to our FAA. They are worried about contamination and spread from bathrooms and planes and I guess also airports. And they are advising that flight attendants and airplane personnel wear diapers instead of using the toilet facilities. So they're taking this virus to a whole new level than what we're doing in the United States.
I was going to say, doesn't that seem a bit extreme?
Well, it does, but it also does point out that they're still very worried about environmental contamination, not just spread from the air. And that's the take-home message I get from that, that yes, this is mainly spread by air and aerosols, but it can still spread from things in the environment, so we still need to wash our hands after you open packages and be very careful around the packaging itself. So I would be very, very careful during this time of pandemic spiking that we're seeing.
253-5959 is the phone number. It's also our Auto Tech Service text line if you want to get on the air with Dr. K this morning. How about a vaccine update?
Well, the vaccine has been approved for Pfizer, and that's extremely good. Moderna, I believe, will be approved next week. The main problem with the vaccines is that they're not going to be coming soon enough. Hopefully, they'll be coming in the next couple of months, so we do need to hunker down, obey public health advisements, and keep safe till then. But it is good because, normally at the start of this pandemic, we would have been saying, well, it'll take 5 to 10 years to get a vaccine. Now we're complaining about whether it's 1 month, 2 months, or 3 months before high-risk people will receive one.
But now Pfizer's vaccine received emergency use authorization, but that's not FDA approval. Is that right?
That's correct. They haven't gone through the full data and the full phase 3 study results. There's still long-term results that can come in. So it's not approved. It's just an emergency use authorization. But I should add that the vast majority of complications which occur with the vaccine occur within the first 2 months. And that data is in. What isn't known is how long your immunity will last. It's also not known if it just makes bad infections an asymptomatic infection and you can still spread the virus. That data is out yet. We just don't know. So if you get the vaccine and you're lucky enough to get one, please still follow public health guidance, wearing a mask and socially distance.
Now they'll be starting to distribute that when? Next week maybe?
I think it's going to be next week. Yeah, it's going to be fast.
And there's been some discussion about not having as many doses as we would prefer, right? In Kentucky, I mean.
Well, definitely. And that's nationwide. I think we're probably down to about 10% of what I was hoping. We were initially thinking you'd have 50 million doses per approved manufacturer by the end of the year because we were manufacturing at risk. Doesn't look like that worked out too well. And remember, everybody who's vaccinated requires 2 doses of the vaccine. So 50 million doses nationally would equate to 25 million people vaccinated. And that is just probably enough to comfortably cover the healthcare workers and nursing home residents.
Here's a question from our Auto Tech Service text line, 253-5959. I'm not sure what they mean by this, but it says, please ask the doctor why we are getting the vaccines so quickly.
Well, mainly because it's a new technology, and that has to do with mRNA. They were able to just put in the code, the machine produces the vaccine, and you can start testing it. And it bypasses a lot of the problems of the other vaccines. It produces the spike protein of the virus. It is a very specific response that it elicits, And these mRNA vaccines are just entirely new technology. So if this virus does mutate, and I expect sometime it will, it's already done that in the mink population, this type of technology could print out a new vaccine within weeks and start trials or take the vaccine. So I think that we're seeing an evolution in vaccines, hopefully both in effectiveness and safety.
Rudy Giuliani is out of the hospital after being treated for coronavirus. He's 76, former New York City mayor. Hospitalized Sunday at Georgetown University Hospital after testing positive for COVID-19. He was released on Wednesday, and Giuliani called his hospital treatment miraculous, tweeting, "I walked in with serious symptoms and walked out better than ever." I wondered when I read this morning, is he on the feel-good meds and that's why he feels so good?
Who knows? It is possible. He definitely tweeted out that he was also receiving top line care. I mean, when you're a integral part of the United States infrastructure, which, I mean, he's a major advisor to the president, you're going to get top care and you're going to have access to, for example, the monoclonal antibodies and supervision and care that the general person may not have access to because we are in a shortage situation, especially while this virus is peaking. So to get back to the original theme, please follow public health advice and keep yourself safe.
All right, we're going to talk in greater length about the lifting of the mandate in Kentucky on the restaurants. But before we get there, I want to ask you, the governor shut the restaurants down over a specific amount of time, 3 or 4 weeks, whatever it was. Did he get the result that he was hoping for, A, and B, will we go back to the way it was when we open the restaurants back up?
Well, I think he did get a result because you saw a blunting of the increase in viral infections. And we're not overrun yet with the virus. If you look at Tennessee, they've got mobile morgues now going to both Johnson City and Knoxville. They're in a much worse situation. And I should add, I can only keep thinking back to the callers and the shows that we were just beat to death on how good Tennessee was doing and you don't have to worry about the virus. Well, that was just all fake news.
You could go across the border to dinner and have dinner in restaurants, and you couldn't do it here, and people were going crazy.
Yeah, right. So, I mean, that was just fake news. We've seen that before. We saw that with California. Oh, they've reached herd immunity. We were beat to death over that. Well, again, fake news. California's eaten up with this thing now. So, yes, there was an effect by the blunting of the pandemic. But the virus has not gone down. And to me, you've got a test positivity rate over 9%. We're still way too high in cases, between 3,000 to 4,000. Yesterday, it was over 4,000 cases. It's very problematic to go to indoor dining. These are dangerous venues. I would strongly encourage people to do either pickup or delivery. And it's not only the indoor dining, but it's bars, it's gyms. All of this, I think, is a risky activity. And let me just take a minute to talk about masks. This is a layer of armor. Just because you wear a mask and social distance doesn't mean you're going to be safe. You're safer. It's like being in a foxhole. There's a bulletproof vest. You're going to want to put it on. But if there's 20 machine guns up on the hill aiming at you, that bulletproof vest isn't enough protection to jump out of the foxhole. So if you have to go pick up groceries, yes, wear a mask, you'll be safer. But don't increase dangerous activities and behaviors at the time that the virus is so prevalent in our community. Please stay safe because we don't want to have our healthcare system become overrun, similar to the healthcare systems around the nation and our southern neighbor, Tennessee.
Dr. Kevin Kavanagh is with us, and I found something out about the good doctor. He's a little squeamish when it comes to getting shot. Am I right, Dr. K?
Yeah, that's true.
Are you kind of a baby, or are you a little bit of a baby when it comes to getting a shot?
Well, that's true. And that was kind of a running joke at one of the universities I was at, which was University of Tennessee. I was a cancer surgeon doing massive surgeries, jaw, tongue, necks, but yet when I was sitting in an office and they'd bring a shot up, I was, yes, very squeamish. So, what can I say? It is what it is. It's kind of like Doc Martin,
That's right. Well, I've heard doctors are the worst patients in the world anyway. Okay, got a bunch of texts. We'll try to get to them. It was reported on the news that the vaccine can cause side effects strong enough to cause recipients to take the next day off work. My question is, if healthcare workers get vaccines first and side effects can cause recipients to take the next day off work, will they stagger vaccine delivery to ensure they don't create a shortage of healthcare workers, which is a logical question.
Yes, I'm sure that they will. And I should note that the next day off of work is also an advisement with the shingles vaccine. So it's not uncommon. It means you're mounting a really good response to this vaccine and to fight off the coronavirus. So that can be looked at actually as a good thing. Plus, you get a day off of work.
Yeah, there you go. Here is what about folks who have to work at Amazon with hundreds of other people. I guess you just have to wear a mask and distance the best you can, right?
Well, yes. And to me, I think that should be covered under OSHA requirements. And I know there's this big thing about, our rights on masks, blah, blah, blah. But mask mandates by employers have been in place for a long time in construction areas, shipyards. This is all mandated by OSHA. You can go on the website and look it up. It's not a new thing. It only appears to be very controversial when you're wearing the mask to prevent a coronavirus. So it's not just the wearing a mask. Plus, there have been mandates for helmets, for shoes, and of course, we've had seat buckles, and plus, you're mandated to just wear clothes when you go into a building. So please get good protection.
Why? Somebody wrote and asked a pretty good question. Why are they not cremating bodies? I guess you said they are in Tennessee, right?
Not sure. I'm not sure. And I don't know about the availability of crematoriums. I really don't know that question. That is a really good question, though, because, obviously, if you have a mobile morgue, it means the morgues are not only filled, but so are the funeral homes.
Mobile morgues, that's what you said about Tennessee, not cremating. I'm sorry. My bad. Todd says, and I think he probably brings up sentiments of others, if it's dangerous to go indoor dining, then it's too dangerous to go to Rupp Arena and see a basketball game. And we've had this discussion before, but I understand what Todd's saying. I guess the answer would be that Rupp Arena is so large, and when you limit the number of people, there's plenty of space in there. But he brings up a good point.
Well, he does, and I side on the side of, maybe that's not a necessary activity where we're in this extreme surge. I think that activity is problematic. It's not only sitting in the arena, but most of the fans are shouting or screaming, which will aerosolize the virus. It goes much farther than 6 feet at that point. And you also have problems of common areas such as bathrooms and getting in and out of the arena. So it's problematic. Is it an activity that we really need? And from what I can see on the news media, we're not playing that good anyway. So to me, I would put that off until the virus rates in the community are lower.
Okay, I think you may have just sort of answered this. Josh says, does he think that dining out at a restaurant is more dangerous than standing in line at Walmart?
Well, probably not, but I don't stand in line in Walmart either. But when you do stand in line in Walmart, you have to remember you're wearing a mask, you're not talking, aerosolization is going to be down. But still, at this point in time in the pandemic with the virus spiking, I order online or I will do pickup for my groceries. I'm not going inside unless you absolutely have to.
All right, Bill says, why do we focus on cases? More testing equal more cases and all that. Positivity rates, death rates, and ICU beds are way more important to watch, and quote.
Well, that is true. I mean, that is a better metric or more reliable metric, but cases do predict the others. So when you see a high case rate, the others will be following. And that has been pretty accurate over the last 9 months. So the narrative of the high rates in cases is just because we're testing more. That's a false narrative. We're testing more because as the virus gets more prevalent in the community, more people get symptoms, more people are being exposed, more people are requesting and going for tests. So that's what's happening. It's pretty reliable. When you look at a spike in the cases, you will see 1 to 2 weeks down the line a spike in the death rates. And so that's why we focus on cases, because it is a harbinger of bad things to come. And that's been proven over the last 9 months. So again, false narrative that cases are just due to testing.
Okay, here's a question that says from our Auto Tech Service text line, is the temporary COVID hospital still set up at UK, I think, Craft Center? If not, where is all the equipment now, and can it be set up quickly again if needed?
I'll be honest with you, I don't know the answer to that question. I would hope it is either set up or we've got equipment ready to be deployed if needed, because our behavior is not good as far as suppressing this pandemic. And as Dr. Ryan Stanton has stated, they're starting to see some reinfections. So this idea of herd immunity, well, it's just not going to take place. Plus, the herd includes both cats, dogs, minks, etc. This virus is going to be with us. We need to learn how to live with it safely.
Have you heard anything about whatever is going on in India?
No, I haven't, Jack.
Well, they don't know much about it, but it's some sort of virus that has begun over there. Is not related to COVID. It has begun to wane, but it is something certainly that we need to keep our eye on, and that's all we need right now is another one, right?
Well, and that's true, but the way things are going, we probably will have another one in the next few years. You have to remember, the reason why we're able to get the vaccine and the mRNA technology is that companies were getting geared up for this for the past several years. This was quite evident this was coming. They were doing scenarios such as crimson contagion in order to predict what was going to happen during a pandemic and that our response would be better prepared. People were gearing up for this. So this is not entirely unexpected. So yes, when we get through this one, we need to make sure we keep what we've learned, we're prepared, and that when the next one hits, we can take it in stride. Kind of like what happened in Australia, New Zealand, Thailand, and South Korea, rather than being in the severe place that we're at right now.
So let's assume that they'll start with the vaccines next week with the frontline workers and perhaps elderly and nursing homes and all that, and then eventually we'll get to the regular folks in, what do you think, maybe in the spring, and maybe have everybody covered by the fall. Do you think by next Christmas we'll be back to quote-unquote normal, or will we ever get back to normal?
Well, I think we'll be back to a new normal. I think that we'll have a large segment of the population that isn't going to get the vaccine, and I think that that's, at this point, ill-advised, but it'll be a new normal. I think we'll be visiting again, traveling again, but I do think you'll see more of attention to hygiene and that we'll be acting a bit differently. And that may be to the good.
That's right. I've got to jump. Thank you very much, Dr. Kavanagh. Have a good weekend.